Pneumonia itself is an actual infection in the lung tissue. It can be viral, it can be bacterial. The very young, children less than 5 years old, and the old, people over 65 years old, not that that's very old, but are at higher risk for developing more severe cases of pneumonia. The primary complications of pneumonia would be sepsis. That would be the one I think that doctors would probably be concerned the most of, and that's basically where the bacteria goes from your lung, actually gets in your bloodstream, and now you have the infection in your bloodstream, and ultimately that can cause other organs to fail, and that frequently is the cause of death in people with pneumonia. They ultimately become septic from the pneumonia and die of basically a blood infection. Other things that you'd be concerned of would be abscess formation, where you can actually form an abscess in the lung itself from pneumonia, or spread of the infection to other areas such as the brain. So those are the complications that doctors are going to be concerned about, and reasons that docs want to treat it aggressively. The precautions to prevent pneumonia are also similar to precautions to prevent influenza, which is frequent hand washing, so good hygiene, and also people staying at home when they're sick and not exposing other people in their workplace and friends and that sort of thing in the public when they're sick, exposing them to whatever they may have. So really, it pretty much the same precautions. However, pneumonia itself is a more lethal disease. It's actually the 8th leading cause of death in the United States. And so, precautions for it when you're around somebody who has pneumonia, I think that it's really important that you take very strict precautions to help prevent yourself from getting it. And especially in families with young children, because of the fact that they're at higher risk of the lethality and higher morbidity and mortality regarding pneumonia. It's really important that families with young children, if there's somebody in the family that becomes exposed to pneumonia, that they be looked at and be treated if they have it, probably aggressively, and that good hygiene is taken up in the family to help prevent passing it from one person to another. Pneumonia is a common complication to flu, and really one of the primary reasons that getting flu vaccines is important, especially in the elderly, is because the flu leads to pneumonia. We also have a pneumonia vaccine, which is specifically for strep pneumoniae, which is the most common cause, and will lower your risk of getting strep pneumoniae pneumonia. But there are other bacteria that can cause pneumonia as well. It's just that the strep pneumoniae is the most common cause. And so the pneumonia shot in people over 65 years old will help decrease your risk of getting that type of pneumonia. And also people that have other underlying heart problems and underlying lung problems like emphysema or chronic bronchitis should consider getting the pneumonia shot also to help ward it off. Anyone over 65 needs to get a flu shot every year, and they need to get a pneumonia shot really right about the time that they turn 65, and then most often doctors will repeat that shot again in about 5 years after that, just to give it a boost, and that helps protect you. And once again, it doesn't completely prevent pneumonia because there are other causes. There are viral causes of pneumonia, and there are other bacteria that can be involved. If you're at home with symptoms of high fever and coughing, especially if you're coughing up green or yellow sputum, maybe blood tinged, you're having shortness of breath, frequently you'll have some chest pain associated with the cough. These are all signs that you may have pneumonia and you need to be evaluated. And doc's going to probably listen to your chest, listen for abnormal lung sounds, and then maybe do a chest x-ray to confirm whether or not you have pneumonia. And if you have it, if you're a healthy person and you have pneumonia, they're probably going to put you on an antibiotic and treat you as an outpatient at home and just tell you to stay home and away from work. And it'll take a week or so, 10 days for you to get better. If you're very young or very old or have other lung problems or heart problems, then you're probably going to be placed in the hospital and maybe even put on IV antibiotics due to the lethality of pneumonia. Once again, it's the 8th leading cause of death in the U.S. even today, even with modern antibiotics, which is fairly significant. So it's a disease that we should be aware of, that it can be a complicating factor to other minor infections or less serious infections like the flu. But if you're getting sicker with even colds or the flu at home, and you're developing higher fevers and coughing up blood or yellow or green sputum, then certainly an evaluation by a physician is warranted to make sure that it's not pneumonia.